Hey friends, so here we are once again in front of you. I hope you all are doing well and you have practiced those all alignments which we have discussed. We have so many questions now. So now we are moving a little bit forward to the seated forward extension poses, right? The seated forward bend, what you say. So in the earlier class we have discussed about the Paschimottanasana, so west side stretch. The next posture which we are going to talk about today with all the adjustment and alignment is your Janu Shirsasana. The Janu Sirsasana, head to toe pose or head to knee pose depend upon your variations. So basically we say head to knee pose, Janu Sirsasana. So Janu is for the knee, Sirs for your head to touch towards your knee. This is also the category of forward extension, forward bending, the seated forward bend. So here, one more time with me, my colleague, Mr. Shobit is here to perform this pose, and we try to give you the best to the best from beginner to the advanced level, how to use the prop safely, how to prevent injuries too. So the next pose which we are going to talk about today, my dear friends, Janu Sirsasana, head to knee pose. So Mr. Shobit, can you please come to the sitting posture with legs straight forward. So as we have discussed earlier in the pose, what we have discussed that the pelvis, the tilt of the pelvis, where it is going, whether it is going forward, whether it is going backward. Here also, I need to check first neutral pelvis. Maybe sometime, my dear friends, you see the pelvic is neutral. But as you ask your student to bend your one knee, sometimes the pelvis is going backwards. Sometimes there's one side which is tight, it goes lift. It goes uplift like this way. So as we see now, we ask the student how to get into the pose slowly and slowly and slowly. Maybe you find sometime that in this pose, pelvic is neutral. But sometimes there is a tightness on your front hip muscles that as you try to bend your knee, it gets compressed and it creates the pressure on the opposite side, the leg which is straight. So here we can see in more deep that how to prevent those imbalances too. So as we have discussed in the earlier class that you can use the cushion, you can use the strap, you can use the blocks, same alignment you have to do here. Right, the same alignment we have to do it here now. So as I see the pelvic is neutral now, if in the wrong way we demonstrate you, can you please lift your hips up, lift your hips up. Now, if my client is bending his right knee, try to bend your right knee. Yeah, this one. So here it is, now you can check what is happening, the pressure. So is it possible, Mr. Shobit, to bring this shirt out? So just bend your knee slightly more forward. Yes. Here you can see what is happening here. This side is going down, this side is more lift up. Imbalance on the muscles again. This is, I'm showing you the wrong way. So it doesn't mean, guys, that you have to touch this heel to the knee. This is not our goal. Until we don't find the equal balance on the both sides of the muscles. So first and foremost, we have to ask the client if the problem is here. This much is okay, stay here, right? If this much is the range and we find that my client back is lengthened easily and pelvic is neutral on the both sides. So we have to check this from here that this dimples has to be aligned. These dimples which you find on the back of your spine. These dimples has to be aligned. It has not to be go one forward, one upward. Bring your knee slightly more towards your hips. See what is happening here. Rounding and the dimples are not aligned. The one part is going more backwards, another part is going more forward. So that can create pressure on your disc. So it's better to use the cushion, it's better to use block, it's better to use roll mats. So here I am using the cushion. So take the flap out first, So here we can go, extend your knee this, all the way, all the way. So maintain the natural curve here on your lower back. Slightly bend your right knee now. Bend your right knee, slowly and slowly, brother, slowly and slowly. Here I checked, yes, the pelvic is okay. Then only allow my student, stop it here. If I ask, or if I see that here it is stable, I ask, stop it here. My goal is not for the beginners to bring it to all the way to your thighs, all the way on your hips. Where I feel that there is equal lengthening and my pelvic is neutral here, my hips are not tilting upward and downward, this is the place from where I have to start to begin with the beginners. So here I can see now, in this Janu Sirsasana now, before to get into this pose, just stabilize your knee from here now, neutral. It has not to be go out, it has not to be go in. It has to be neutral, in line with second toe. Now the next thing what we have to do into the Janu Sirsasana, try to go for the next position. So bring your hand. Okay, so rotate it out. So before to get into this rotation, this Janu Sirsasana pose, again go back. Here we can learn, rotate your this out first. So you can create some space. So rotate your ankle out first. Rather to take it straight up to the hip joint, rotate it first so you can create this space, the external rotation of femur. So you can create the space in your hip joint. Then we can ask slowly and slowly, first and foremost, you can stabilize here and then rotate it out. So then this angle, if we see, as the client is going from this part, now go to the next position. So slowly, slowly you can walk on your fingers, walk on your fingers. Or if the limitation is here, just try to hold it here. First, try to check the lengthening of the spine. So bring your heart forward, bring your heart forward, bring your heart forward, bring your heart forward. If the limitation on the range of motion, again we use the chair. Again we can use the chair. So here we can extend the spine easily, and I can add one stretch to the spinal column too. I can place this strap on the front of the hip bone, on the front of the hip bone. That is your, where we can say on the ASIS, not on the belly, not on the ground, not on the groin region, on the front of the hip bone. So here I can stabilize the hip joint too, and I can add some stress to release the pressure from the lower back and the whole spinal muscles. So here you can see the lengthening on the spine. Is it possible for you, Shobit, to just slide the chair a little bit forward, 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 that's it. And here you can see, guys, the equal lengthening of the muscles, right? The equal lengthening on the spinal muscles. So here we can use this therapeutic effect and we can gain more extra effect of this posture on the lower back and the equal lengthening of the paraspinal muscle, that is your spinal extensors. So we can hold it for 20 to 30 seconds and then slowly release it. So after releasing it, slowly and slowly, then we can go to the next part of this posture. So the next part of this pose, we can ask, just slightly hold it more down. And here too, upliftment of the head, we can use the block, so you can relax your head here. So now you can see the pose, the complete lengthening of the muscles. If you see the pressure is more here, then bring your neck up. Neck has no pressure now. This modification you can use too for the beginners to the intermediate level. Then slowly and slowly we can remove the chair. So bring your head up. Bring your hands on your pelvis. Straighten your spine. We remove the chair now. Then we can use the block here. Just try to extend your spine first. Bring your hands up. Bring your heart forward. Heart forward, ribs soft. Very good. Lengthen. Hold it, hold it, hold it. If you don't want to go down more, you can hold these blocks here now. That's it. This is another modifications which we can use. If it is not able, we can hold it here too. Extend your spine. Bring it down slightly. That's it. So no need to push too much. As we feel the range of motion is getting increased, bring back. Go backwards. Now, bring your spine into the extension first. Hands on the pelvis, brother. Hands on the pelvis. Roll your pelvis slightly forward. Anterior tilt. Bring your hands up. Bring your heart forward. Bring your heart forward. Extend your spine. Open your chest. Open your chest. No pressure on the neck muscles. You can keep your hands slightly wider. No pressure on the neck muscles. No pressure on the shoulder. Hold it here. And then, if it's possible, you can release your head. So this is the modification which we can use for the advanced level of the student. Right, the advanced level of the student, this modification we can use. You can hold the pose 60 seconds, 90, 120 seconds according to your own capacity. Breath has to be flow easily. You have to enjoy the breath. This will give you the posterior stretch of your muscles of your body and slightly stretch to your adductor muscles, the inner thigh muscles. And this posture will help you to go for the hip opening poses. So a beautiful stretch, you can get two benefits from here, hip opening plus back lengthening. So increase the blood circulation around your hip joint, which is the most challenging problem nowadays with all of us, and lengthening of your back muscles, which we have more restrictions to. Now come back, brother, into the pose. Come back to the normal pose. Bring your hands on your pelvis. Lift your pelvis up now and spine extended. So from here, second thing which we have to avoid, just change the leg now so we can see from this angle. So as you're trying to go, sometimes people do this mistake that here, they are trying to bring the knee here, bring the ankle on this knee and trying to press this. Compression. It will create compression here. So if you're trying to press it here, you have a meniscus, you have a ligaments, you have a cartilage, maybe you can damage slowly and slowly if you practice this wrongly. So if you want to take it down slightly, or if you want to take it slightly more upwards. If your range is there, bring it to the knee, bring it to the knee. No need to press, just slightly bring it away. Right, just slightly bring it away. Yes, you can use the strap too, if you're not able to get the chair or if you're not able to reach to the toes, you can use the strap. This is another modification which we can use. And if the range of motion is good, you can bring the knee slightly more up. Try to get this heel away from the groin. This is more sensitive area, right? More important organs you have. So no need to push them too much harder. So maybe sometime hernia can create or it can damage your soft tissues too. So you can use the strap and slightly extend your spine forward. Extend your spine forward, extend your spine forward. So this is another modification. If we don't have a chair, we don't have a blocks, you can use the strap, you can use your towel too, but no more compression on the heel bone here. Right? No more compression on your metatarsals. Just be aware about that, my dear friends. Then we can release this and go for the final pose now. So extend your spine and release your head. So you have to check that the movement is not going only one side. This is wrong. It has to be equally distributed. And slightly it gives you the lateral extension of your muscles. The lateral muscles get more stretch here on the side which you are stretching. So two benefits and more than two benefits you can get. If I talk about in relation to the muscles, back muscles, hip opening, right? The neck muscles get stretched here. You can gain more blood circulation on your digestive organ around your hip joint. So there is more regeneration of your cells and tissues, and muscles get more blood circulation, so it can be get actively more in a right way. It cannot get loses its tone. It can get the tone easily back. Release, brother. Go to the neutral position. So from the heel, bring your hands to the knees, then to the pelvis, and then extend your spine. It's not you are trying to getting the spine directly straight. That create extra stress on your lumbar spine and your sacrum and your tailbone too. So I hope this must be clear to you guys. It is a beautiful pose. Go, practice, teach, repeat, 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 and feel the benefits of this pose. Any questions, any queries, we'll discuss anytime. You are most welcome. Till then, enjoy this pose. Open your hips, open your spinal column, release the stress from your spine, and feel free to float in this life. Thank you so much. Namaste. Have a nice day.